This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. It is the final Monday of the month, and that means we are talking things over with Dr. Brian Huggins, health officer from the Monongalia County Health Department. And Dr. Huggins, good morning.
Good morning, Kyle.
Thanks for coming in.
Thanks for having me back.
Good to see you. Okay, so when we talked about summer safety earlier this year, you brought up something that I'd never heard of at the time. And we talked about it a little bit, but we're really going to go into detail about people that are having a severe allergic reaction after getting a tick bite. And this is called alpha-gal syndrome. So let's start there. What is it? Define it.
So alpha-gal syndrome is when your body has a reaction to be basically eating a carbohydrate molecule found in a lot of mammals. Essentially what you get is you get allergic to meat. So once you get this tick bite, and this is lifelong, you have an allergy to eating meat, and unfortunately not just meat, but also products from mammals. So dairy products. So that means no more cheese, no more milk, and it's a lot like any other food allergy. So when people think of, okay, I've got an allergy to nuts, or even to some extent celiac disease, an allergy to gluten, it's really kind of I don't know. It can have different levels of symptoms. You can just get diarrhea, or you can get anaphylaxis and die.
Wow. Okay, so we know a lot about Lyme disease, and we've heard of Rocky Mountain spotted fever through the years. Lyme disease was trending up and probably still is, right?
It is, yeah.
Okay, now add to this alpha-gal syndrome. That's kind of a funny name. How did the name originate?
I know. Everybody hears that and they go, what is alpha-gal? And of course, scientists being scientists, the actual molecule that you become allergic to is galactose alpha 1,3 galactose, which I would not want to say.
True.
Right, that. So they just shortened it to alpha-gal syndrome. And that's where the name comes from.
Okay, so it has nothing to do with gender. This is not attacking females only. This is a male or a female
right
malady.
Yep.
Okay, so let's get that out of the way.
Exactly.
Okay, so what types of meat are we talking about that people that are afflicted with this have the allergic reaction to?
Yep. So it's your traditional kinds of red meat. So it's anything from a mammal. So it's going to be beef from cows. It's going to be pigs. So it's going to be any pork products that you're going to eat, sheep, and then goats, but then all wild, like venison, deer. If you were to eat, say, like moose, which of course is not from around here, but any of those wild game kinds of meat, even technically raccoon, any mammal that is basically not a great ape or a human has this molecule in their body. Okay.
So any type of chicken or fish, that type of thing, it doesn't affect. It's safe.
Yep.
Okay.
It's just another kind of like rabies. This is another thing limited to mammals.
Mm-hmm. All right. Is this a specific kind of tick that spreads that? Or, we've got Dr. Aaron Pollock that comes in twice a week with Hillcrest Veterinary Clinic, and he does a show, and obviously he talks a lot about getting your domestic animals, getting your dogs and cats protected from fleas and ticks. And he always says, if you see a deer, there's ticks.
Yes.
They're everywhere.
Yes, specifically deer ticks, right?
Yes,
which are the ones that are primarily the ones that spread Lyme disease.
Right.
But those are not the ticks that frequently end up on your pets. The ones that are on your pets are actually the American dog tick. So there's unfortunately a variety of ticks out there that can all spread different diseases. And with alpha-gal, the big host tick here is called the Lone Star tick. Have you even heard of the Lone Star tick?
No, I have not.
Right. So imagine where it probably was first discovered.
Texas.
Yeah, you're right. Yeah. Okay. So Lone Star tick. And it's not typically been this far north. But now we go back to the fact that with warmer winters and with longer summers, their range is spreading. So they're seeing them now all the way up into Maine. And they used to be limited to the south. So they basically would kind of be Texas, southeast, not that much in the west yet. But now it's kind of come straight up from Texas, a band straight up, and then over towards the East Coast. And so we're starting to see Lone Star ticks in West Virginia. The black-legged tick, and I'll get into in a minute a little bit about how the disease happens, because this isn't a parasite, this isn't a bacteria. It's a totally different kind of disease. They carry alpha-gal in their mouths. So while animals have it in kind of in their body because there's a carbohydrate, they carry this in their mouths. And so the black-legged tick, the deer tick, also has the capability to have that in its mouth, but it's primarily so far been the Lone Star tick.
Okay, so I say they, well, you would know this. The ticks that carry Lyme disease are tiny. Little teeny tiny, barely visible.
Tiny.
Okay, what does a Lone Star tick look like?
It's a little bit bigger, but it's not. It's going to be a little bit. It has a symbol kind of on its back. I would encourage everybody to just kind of go
Can you
look
see
it up.
it? Is it big enough to, or do you need
when
a mic?
you have it in your, like when you pull it off, you should be able to kind of tell without putting it under a microscope. But a lot of times you do, because they have different sizes, right? Because ticks grow. They're like spiders. They don't. They're not like a butterfly that comes out of a cocoon and boom, there you are. They grow. They're an arachnid, so they will grow over time, and it may be very difficult to tell.
Okay. Alpha-gal syndrome, you develop an allergy to meat from mammals. It's caused by the Lone Star tick. Anything else spread it?
Not as of right now. And the reason that this is a problem, because a lot of people have asked, well, I eat meat all the time. Why don't I get an allergy to it? Why is it this tick causes me to get an allergy? And it's about how your body processes it. So since we as humans don't have this carbohydrate naturally, it is considered a foreign material. Well, when you eat beef, when you eat a steak, it goes into your intestine. And when it crosses over, it gets surrounded by fat molecules. So your body, by the time it gets into your blood, it doesn't look the same. It looks a little different. When a tick bites you, if it has it in its saliva, it can go directly into your bloodstream. With it going directly into your bloodstream without that processing through your intestine, the body sees it and says, that's foreign. I need to fight that. And as soon as it does that, it develops antibodies to it and it attacks it. Well, now the next time you go to eat meat, and there's sometimes a delay in the processing, when your body does bring it up from the intestine, now pieces of that molecule are more recognizable and the body immediately begins to attack it, and it makes you very sick.
Mm-hmm. What carries Lone Star ticks? Anything and everything? Are they on deer? Are they on the rodents you see in your neighborhood? Can they get on your dog and cat?
All of the above. They basically bite just like any other tick. They're looking for a blood meal. And the way they get on you, they're crazy little creatures. If you actually see them, they'll go to the ends of leaves. They'll go to the ends of tips of grass, and they kind of put out their front arms because they're hoping they're going to grab something when it walks through. And so a lot of people think, well, I wasn't really in deep grass. I wasn't really in a deep forest, but you don't have to be, because they will just, especially when they've got babies out and they're little tiny. Like you said, the black-legged tick in particular, it almost looks like a mite. You know, I mean, they're very small.
Like a period.
Yeah.
Like on a printed piece of paper.
Yeah. Some people have said that they looked down at their legs and they thought that they had just gotten a little bit of dirt or dust on it. And then they realized they weren't just like coming off. Like it because you just, and a lot of people that get bit by ticks have no idea, because they can take a blood meal. We all think of that big American dog tick that's engorged, you know, that's like the size of like a penny, right? You know, and you're like, how would I not notice getting bit by a tick? These small ones, they can come in, get a blood meal, drop off of you, and disappear, and you have no idea that you had a tick bite.
All right. So how do you prevent this?
Yeah. Right.
Something else to worry about. How do you
Right.
prevent it?
Right. And that's obviously it's tick precautions. And the best thing that you can do is that you're going to want to get one of the best things that hardly anybody uses, because we haven't really thought about it, is something called permethrin. Permethrin is a spray that you can put on your clothes. So the two best ways to prevent mosquito and tick bites is you're going to have a spray for your clothes. You're going to have a spray for your skin. The spray for your clothes, permethrin, you can actually saturate your clothes and it will survive multiple washes. So once you spray your clothes, it doesn't discolor your clothes. It will survive multiple washes. If you actually buy clothing that has, they actually make clothing that has been soaked and made with permethrin in it. A lot of outdoor stores will actually sell clothing like that. And that is a great first defense because now it's in your clothes. And that helps a lot for people who hate having poison on their skin, right? Because the next step is either DEET or Picardin, and you spray that on your skin. But depending on the brand and depending on all of that, you can feel tacky, you can feel sticky, and it prevents a lot of people from wearing it because they're like, I feel gross. And so with that, it's like sunscreen. A lot of people just hate putting on sunscreen because they're like, it feels weird on my skin. And I get that. But yeah, that is going to be your best ways to stop getting the tick.
And we're to the point, it seems like, that if you take a walk in the woods, if you hunt, you need to take precautions.
Yeah, it's the percentages of this is what's kind of fascinating, is that it used to be that when they would test people that got a Lone Star tick bite, only about 10% of people might come back with alpha-gal. And the numbers are getting closer to like 40%. So for whatever reason, and scientists, they're still trying to understand this. The way this was even identified is kind of crazy, is they had created a new medicine. And when they gave it to people, it had an additive that had like an animal product. And some of the people they were giving it to were getting a really severe anaphylactic reaction. They're like, we don't understand why. Then that's how they discovered alpha-gal syndrome, was that people were having a reaction to the medicine. So that's another thing is it can actually cause reactions to gelatin, glycerin, things like that are in medicines or that are in other food products, so that you can't eat those as well. And then people that might have a bioprosthetic heart valve. If you have a bioprosthetic heart valve and you get alpha-gal syndrome, there is a chance that you will end up rejecting that valve or it'll deteriorate more quickly. So there's a lot of extra risk with this disease, unfortunately.
Okay, so if you go for a walk in the woods or you're a hunter and you come back and you find a tick on your arm or your leg and it's been there for a couple of hours, what are the chances at that point? Obviously, get it off. Yep. What are the chances at that point that you're in danger of incurring one of these ailments? It's
hard to tell. There's just so many, and that's the problem is there's not good evidence that the faster you get it off, that necessarily you absolutely prevent getting the disease. Obviously, the longer it's sitting there feeding, the more likely it is that it's going to transfer things from its mouth to you. So remove it the best way possible. So that's another big thing, as non-traumatic as possible for the tick. A lot of people I grew up, I think we talked about this, burning the tick off, right? If you burn the tick off, it will vomit in contents of its mouth because you're causing it pain. Yeah, exactly. So the best way to remove a tick, and really the only good way, is that you get a pair of pliers or you get like a tick puller and you get as close to the head as you can and you pull straight up and just pull it out. And it's going to hurt a little bit, but that is the best way to do it.
They make tick pullers. Where do you get a tick puller?
So, you can get tick pullers at almost every kind of like outdoor supply store, I think. And at this time of year, although it's starting to get to be the end of the summer, you probably can find them at Walmart and places like that. At one point, I can't remember if it was DNR or DEP was actually giving away free tick pullers. I think at the home show. That sometimes if somebody shows up and they'll actually have those. We've been talking about if that's something we can invest in and be able to supply those at the health department.
That would be nice. So if you don't have a tick puller, what works? Like you said,
tweezers.
Tweezers. Okay.
Yep. A good pair of tweezers that has a good grip. Some cheap tweezers will just lose, but if you've got a good pair of tweezers, just get real close to the head and pull straight up.
Okay. And again, you're right. That was the way it was done when I was a kid in the 70s. You'd take a match, you'd light it, you'd strike a match, blow it out, and then put that on the tick, with the theory being the tick would release.
Yeah.
But that's the opposite. That's the last thing you want to do.
I tried doing that and it didn't come out, and it just kind of laid there limp. And I'm like, what? And it died. Well, so basically I killed it. Yeah, I burned it and it died on my arm, and then I still had to pull it out. So I guess
Okay. So skip that part. Skip the part with the match and go right with the extraction methods. Okay. So we've talked about prevention. We've talked about tick removal. Mm-hmm. How do you know what are the symptoms of alpha-gal? Is there a test for it?
There is a test. So there's a blood test that you can do. A lot of people think, it's like food allergy. I'll just get the skin prick test like you can do to figure out that. But that doesn't work for this. So there is a blood test. It's not the cheapest blood test. I'm still working on looking at how we would be able to offer that at the health department. So that's something I'd like to be able to offer in the future. But the way that you'll probably notice more than anything is that whenever you eat meat or you eat maybe a mammal product like dairy or cheese, that you're going to get some kind of symptoms. A lot of times it's going to be diarrhea, abdominal pain. You might break out in a rash. Worst case scenario is you're going to have trouble breathing, and then you might go into like anaphylactic shock. So if you actually do start to have trouble breathing, of course, just immediately go to the ER, because they'll be able to give you epinephrine and help relax you and do all of those things that need to be done to save your life. But that is going to be probably your first sign. Unfortunately, it takes a while, because I talked to you about how when you eat the meat, it has to go to your intestine and then get absorbed. It takes about 2 to 4, sometimes up to 6 hours before you're going to notice. It's not going to be I ate a steak, I feel bad. It's going to be I eat a steak, and somewhere about 2 to 6 hours later, I'm going to feel pretty bad. And again, range of symptoms. Some people may have very limited symptoms, and some people may have die.
The anaphylactic shock part of it. Okay. Have we had cases in this region?
So we have had our first identified case in Marion County. So that up until that point, we hadn't really seen a lot in our local area. So we now have a single confirmed case in Marion. And we have been seeing some things in Pennsylvania. So it's around us. It's here. Unfortunately, one of the things that is a little frustrating is just because of funding reasons, there aren't a lot of tick drags happening in the state of West Virginia. Local health departments try to when they can, but that's kind of one of the things that when you lose money is just one of the things that you just stop doing, right? Mm-hmm. And we do have, at the state, they do some randomly throughout the state to just see what diseases are there. But we don't have an active, we're going up to Cooper's Rock every summer. We're going to drag for ticks. We're going to see what's in the ticks. So unfortunately, we don't often know when we have disease until somebody comes down with the disease.
All right. So you haven't done that in Monongalia County this summer. Have they done it in Pennsylvania? Have they done it in areas that surround us that you know of?
So Allegheny County has a pretty robust vector program. I don't know for sure whether or not they have identified any alpha-gal in their area. That's a great question, Kyle. I'll take a look at that, and maybe next time I come back in, I'll have a better answer for you.
Okay, so if you're diagnosed with alpha-gal, you say there's been a case in Marion County. If you're diagnosed with it, is it irreversible? Are you allergic to meat from mammals for the rest of your life?
As of right now, the answer to that is yes. So once your body, because your body has basically now made memory cells that will produce antibody. Your immune system makes memory cells that will produce antibodies to that carbohydrate when it sees it forever. It's just like what we hope with vaccines when you get exposed to a little bit of measles, right? That your body's going to be able to produce antibodies for life to kill that while it's in your body. this is one of those unfortunate things where it's a food product. And so now your body has basically said, this is always a bad thing to see, and it's always going to attack it. So unless they can come up with some kind of immunosuppression specifically for that, the answer right now is this is a lifelong thing.
Okay. We got about 2 minutes left. So there's no treatment for it right now.
Treatment.
So you've got, you get bit by the tick, you have the symptoms, you develop the allergies, and there's really no
avoidance. At that point, it's just don't eat meat.
Okay.
In fact, it's so bad up at Martha's Vineyard, they actually were seeing like a 50% amount of people that were coming back positive. And because it's a small island, the restaurants are now becoming vegetarian restaurants because they have so many people living on the island that have this disease that can't eat meat in the restaurant anymore.
Wow. Well, that's sobering. Where are the biggest pockets of this? You talk about Martha's Vineyard, that's an island. You talk about this originating in the South. Where has the research indicated it is mostly centered?
So you're really seeing it still largely in Texas, Alabama, Mississippi, and coming up. So the further you come up, the less common you see it. But again, changing rapidly. So hopefully we won't see where the state, they've just made it a reportable disease in West Virginia, which is great. So that's something the legislature passed, which means anytime the lab identifies it, it's going to send it to the state. So we're going to be tracking it closely now in West Virginia.
Okay. It is alpha-gal syndrome. If people want to get in touch with you, how do they do that?
So they can get a hold of us at 304-598-5100. That's our main line. I'm not often at my desk, so it's better just to leave a message with them. And that's going to be the best way. We also have our Facebook page, and people can look at that, and we have an ability to get a hold of us through that.
Okay. Dr. Brian Huggins, Health Officer, Monongalia County Health Department, and that 598-5100 number, that's the main number for Mon County Health Department.
Yep. And just for all the hunters, people getting ready for hunting season, be ashamed that you go out to hunt for deer, and then because of getting a tick bite,
you can't eat.
And yep.
All right. So guard yourself against ticks for a lot of reasons, but the latest being this alpha-gal syndrome. Just make sure you take precautions against the ticks. Dr. Huggins, thanks. We appreciate it.
Thanks, Kyle. Have a great day.
That's Mon Health Talk for this Monday on WAJR.